Welcome to this edition of the Beaufort County Report. I'm Chloe G, and I'm here with Rebecca from Drug and Alcohol. Could you tell us a little bit about the event out here today and kind of what your mission is? Obviously, free Narcan,
That's right.
but some more details.
Great. So with the Beaufort County Alcohol and Drug Abuse Department, our mission really is to get out and make sure that the people in Beaufort County are able to live a full, happy, well life. So we offer a whole continuum of services, one of which is prevention and harm reduction. So this event today at Port Royal Town Center is one of our numerous events all around the county where the plan is to saturate Beaufort County with as much free Narcan as possible. And this is made possible from grant money from the South Carolina Department of Alcohol and Other Drug Abuse Services so that we can get free Narcan into the hands of the community so we can save lives.
And from my understanding, this definitely is not your first one. You've had several of these.
That's right.
Have you guys been seeing good turnouts to most of them?
Yes, absolutely. We've had really great turnouts where we've moved them all around the county so it's accessible for everyone. We've covered all of our public libraries in Beaufort County. We also go out, and if people want to request us to come out and do some education, we can do that so that we can teach people how to save lives with Naloxone or brand name Narcan.
And what made you guys decide to use the grant money for this program rather than something else?
So this grant money it's actually federal grant money from Substance Abuse and Mental Health Services Administration that's given out to the states, and then the states can apply for that from the counties. So the counties have access to the free Narcan to give. So what we want to do is make sure we get it into the hands of people who can respond in an overdose situation. And we know that in Beaufort County, that from our first responders and the data that we have on overdoses and fatalities through the coroner's office, that we have a need for Narcan to be in our communities so that people can give this to buy time and for the first responders to get there, to be able to get the person to the hospital if needed. So this will buy time by giving this as overdose reversal.
Can you show us a little bit how it works? And I can hold your other stuff too if
Sure,
if you need me to.
So this is Naloxone. This one's brand name Narcan. Most people have heard of it. You can buy it over the counter now. You can buy it on Amazon. You can buy it at any pharmacy locally for about $45 to $50 now. But we're giving this away. And each box is 2 doses. It's nasal spray is all it is. And has this little device is empty today. But what you would do is if you found a person, we say blue, B-L-U-E. Breathing is shallow or erratic, okay? L meaning their lips might be turning blue from the lack of oxygen. U is they're unresponsive, meaning you can't revive them, sort of rub the sternum and they're not responding to you calling their name. And E is the eyes, the pupils are like pinpoints. If you see blue, you want to go ahead and give Narcan. So you'll have the person on their back, you'll put this in one side and push the plunger, and then you'll roll them back on the side for a couple of minutes. If there's no response to that, then you're going to give them the second dose in the other nostril, and always stay with that person until EMS arrives. We also want people to understand that this will wear off in 30 to 45 minutes. So if they gift this, they need to call first responders to come and assist because the overdose will come back after this wears off. So the person still needs medical attention.
Yeah, this is not just a solution, but it helps before more help can arrive.
That's right. This buys critical time to save a life. And what we want to do is save lives so that, people survive an overdose or a poisoning event. And I say poisoning because a lot of times there is now fentanyl in drugs of all kinds. And last year in the United States, over 75,000 Americans died from fentanyl poisoning. Often people don't know that they're getting fentanyl. They might be using other substances like marijuana, cocaine, heroin, methamphetamine, and they don't realize it, or a counterfeit pill that they think is something else, but it's pure pressed fentanyl because it's cheap and it's also mixed into the other drugs, and they don't know that they're getting those. So that's how fatalities can happen. People don't, it's very unintentional. Additionally, this will work for people who are prescribed opioid medications but they may overtake them, or they may have forgotten they already took that dose and they take it again, and then they could be at risk of an overdose situation. Of course, sometimes, people will get into prescriptions in the medicine cabinet. Sometimes children accidentally get into the prescriptions, or even pets. And this will work on anyone. This will work on all ages, and even pregnant women with no known side effects. And it won't help if it's not an opioid event. But if it is, this can help. So there's no harm in giving it. And there is a Good Samaritan law in the state of South Carolina, so it's that anyone who carries Narcan and gives it to somebody suspecting an overdose, they're protected by the Good Samaritan law. So we encourage citizens to carry this everywhere. I carry it everywhere I go, in my purse or my backpack, because you never know when you're going to be out in a park on a beautiful day like today, and you may encounter somebody who really needs this. This gives them a chance to live, to survive the overdose, and to get help.
I was going to ask, is it safe to keep in your car? Like, it gets really hot here in the summers. Is it safe, or?
Well, we know that it can be stored up to 104 degrees. So if your car is going to heat up above 104 degrees, we encourage you to obviously carry it with you, take it in your purse or your backpack, or take it inside. This is important to have in first aid kits as well. And across Beaufort County government buildings, we now have this in many first aid kits. We encourage business owners and people at home as well to keep this in your first aid kit, just like you would any other first aid supplies.
And then kind of a last thing here, can you tell me a little bit more about this?
Sure, I'd be happy to. I'll trade you. So this is tteamed. We also provide this at our events and in our offices. People can walk into either of our offices in Beaufort or in Bluffton, and we'll give you these things free on the spot and train you how to use them. This is tteamed. It's a drug disposal system. What we don't want is people to have old or unused prescription medications in their cabinets at home. So we encourage people to clean those out, and when you go to dispose of those, you simply put them in here, add water, zip it up, give it a shake, and safely dispose it in the trash, as opposed to putting it in the drug into the water supply. So we want people to safely dispose of drugs at home. And then there are also many drop box locations all across the county. Many pharmacies have them, where people can drop off unused medications.
Awesome. Well, thank you for coming out and taking the time to speak with us, Rebecca.
Thank you very much.
This is an awesome initiative we have going here. So thank you everyone for tuning in to our Beaufort County Report, and we hope to see you at the next free Narcan event.